Hello. We are from Group 1. Here are my group members.
Let's learn about insulin. Have you ever heard about diabetes?
There is two types of diabetes. Type 1 diabetes is due to autoimmune reaction that destroys the beta cells of the pancreas, and cause body not being able to produce or synthesize the insulin needed. While type 2 diabetes is a metabolic disorder, caused by a combination of genetic and lifestyle factors, which promote increase of blood sugar levels. Lack of insulin in our body can cause serious problem. Initially, patient will experience fatigue, headache, blurred vision and thirsty. If untreated, it can cause stroke, heart attack and diabetic neuropathy. Pharmacodynamic of insulin Lispro. 1 unit of Humalog has the same glucose-lowering effect of regular human insulin. Studies demonstrated that Humalog is more effective when given subcutaneously.
So, how does insulin works in our body?
First, insulin will bind with insulin receptor. Then, it will activate IRS protein, which will activate other protein kinase, which allows its localization to the cytosol. It causes the translocation of the glucose transporter 4 to the plasma membrane, thereby promoting glucose uptake.
What about insulin lead discovery?
Before the discovery of insulin, diabetic children rarely lived a year after diagnosis. Untreated diabetics faced blindness, loss of limbs, kidney failure. The only way to treat diabetes in that moment was dietary therapy. The name insulin had been introduced in 1909. In 1921, Dr. Frederick G. Banting isolate the secretions from the islet cells and tout them as treatment for diabetes. In 1922, Leonard Thomson be the first human injected with insulin. A year later, Eli Lilly produced pure bovine insulin. Then, in 1926, insulin had reached an advancement through crystallization. 10 years later, protamine was added into insulin to prolong the effect. In 1946, Nordisk formulates NPH insulin. Then, the insulin amino acid sequence was determined during 1955 by Frederickson. This led to production of genetically engineered insulin.
Let's discuss on preclinical development.
At first, insulin was tested on dog and rabbit, but the insulin was toxic and caused pain and fever. Then, they ligate dog pancreas to produce insulin that cost 10 dogs' life, and the insulin injected back to other dog. But the progress was slow. Then they used scratch hormone to force the pancreas to work. Then, cow was used to produce more insulin, which tested on dog with decrease of glucose level to 0.18% before being tested on human and rabbit.
Now, clinical trial of insulin.
For the pharmacokinetics, bodies will undergo absorption of insulin through injection to lower the glycemia level. There is 4 modes of administration. Intravenous for short-acting insulin. Intramuscular is the last option for patient with hyperosmotic coma and diabetic ketoacidosis. Subcutaneous is the common and most safe and easy method. Inhalation is also for short-acting insulin, factor influencing insulin absorption. Site of injection with abdominal being the most rapid. Second, depth of injection. Insulin formulation with U500 is the best, and lastly, it depends on volume of dosage. Insulin will be removed from our body through receptor that will mediate its uptake, intracellular degradation, and with the help of liver. In the first phase of insulin clinical trial, it was tested with above 100,000 participants and clinical trial also being done to prevent insulin complication on 300 participants. In phase 3, clinical trial showed that combination of insulin will have better result by reducing glucose level,